Thank you for having us. It's a pleasure to be underneath your bright lights here. My name is Gresham Bouma. I'm your candidate for Idaho Senate. I've lived in the area for about 14 years. I'm a small businessman contractor. I've been married to my wife Wendy for 26 years, and we have 4 children, and two still at home. My background includes degrees in solar technology and accounting, and I have business auditing cities and schools, working as a school district business manager. I got certified to teach. As a school district business manager, I decided that teachers had a lot more challenge and interest in their profession than I did as a bean counter. So I got certified to teach and taught school in southern Idaho for 6 years. I've been a small businessman in our area now about 14 years, and I believe that background gives me what I need to address issues in all of Idaho's important areas. I'm also an avid student of economics. It's probably the accounting and the economics that prompted me to run for office. I believe in limited government, individual liberties, personal responsibility, private property rights, less job-stifling regulation, and Idaho control over Idaho's wildlife and resources. I believe that the government's primary role is protecting universal individual rights, and that government needs to be both accountable and transparent. We should be as close to the people as possible. That is why our states, as affirmed in our Constitution, should be stronger entities than the federal government, far more limited in scope and responsibilities. Once again, I'm Gresham Bouma, running for Idaho Senate, and I thank you for your vote November 6th.
Thank you very much for the invitation. It was a pleasure to be here 2 years ago, and Gresham and I were both here 2 years ago, and it's a pleasure to be back. This is a wonderful forum. My name is Dan Schmidt. I got elected 2 years ago to the Idaho State Senate, and I've been serving as the state senator for 2 years. I'm a family physician, and you guys have asked us to come here today to talk, but honestly, the most important role of a politician, and to me the most important role of a physician, is that of listening. We need to listen to our constituents. We need to listen to the worries and the fears and the needs of our constituents and address those appropriately. Let me tell you a story. I'm a family physician. I'm the only health professional in the Idaho Senate. The governor chose this last summer to appoint me to a commission to study the expansion of Medicaid in the state of Idaho. This is an optional possibility under the Affordable Care Act, which the Supreme Court has said states do not have to do. So we are studying it, and our governor has decided that's something that should be studied. I heard clearly from a constituent here in this community that expansion of this sort of program creates dependence and unnecessary reliance on entitlement programs. That was his fear. I shared that with the healthcare task force. It's not personally a fear of mine, but it's a fear. It's a fear that people have and that is shared. I shared that with the task force. We're working to address that fear to make sure that that is not a problem as we move forward. I appreciate you guys listening today. I guess we're supposed to talk. Thank you very much for this time. Dan Schmidt.
Thank you, Senator Schmidt and Mr. Gresham Bouma. At this time, I would like to invite Ms. Faith Crawford to the stage. She will be asking questions of you both. Just in case you hadn't noticed, whoever receives that question second will then begin their clarification, 2-minute clarification, following those questions.
Thank you, Ollie. And thank you to you, Senator Schmidt and Mr. Bouma, for joining us today. I appreciate you guys taking the time. And so I'd like to start my questioning with you, Senator Schmidt. You just talked about this concern that the constituents have over the the expansion of Medicaid in Idaho. And I believe in a Daily News article you were talking about, we need to have more Medicaid coverage in Idaho so that we can ease the Idaho taxpayers' burden and eliminate the wasteful forms of universal coverage in Idaho. So I'm wondering, how exactly does passing the financial burden to the federal level solve the larger economic healthcare issues at hand? And what do you think is the ideal role of the federal government in the healthcare choices of Idahoans? And how are you going to specifically address the fears of your constituents?
Thank you very much, Faith. There's a lot there, but I'm going to have to describe what my perception of the Idaho landscape currently is in terms of healthcare. Most people don't know, but we actually have universal healthcare in Idaho and have had for quite a while. How many of you guys have health insurance? Hands, come on. There's a few that don't. I didn't ask who didn't. There's quite a few that don't. So, if one of you guys doesn't, walks across the street, gets hit by a car, paralyzed, how is your health care going to be paid for right now in the state of Idaho? It's going to be paid. You're going to get taken to the hospital, you're going to get treatment, and it will be paid for. It's paid for by the county, Latah County. Latah County pays the first $11,000. If it's above $11,000, and most of the time it is, it goes to the state. Last year, that cost the state of Idaho $70 million to pay for care for the uninsured. If we expanded Medicaid to cover about 100,000 people, that $70 million, the studies have shown, would go away. The payment would come from a federal program that would then be managed at the state level. Medicaid is a federally funded but state-managed program. Idaho can manage this program according to its wishes, according to our culture and our values. We should exert that, and we should ask the question fundamentally, do we like the program we have now? Should we shape this program in a way that addresses our values? I believe we can, and there are lots of details.
Thank you, Senator Schmidt. And now, Mr. Bouma, I have a question for you regarding healthcare also. On your website, you say that we need to put more power in the hands of the consumer by allowing a cafeteria-style approach to benefits offered by health insurance companies with full disclosure of costs. And so, I'm wondering, competition may produce a wider array of more affordable care, but will it improve the quality of care? How do we ensure that healthcare providers don't cut corners in order to keep costs down?
Actually, in the private market, competition affects both cost and quality. You're forced to compete in the private market generally in most areas. Medicine hasn't had a free market for a long time. As Milton Friedman predicted in 1961, the government granting the AMA what almost amounts to a monopoly would increase cost and reduce quality both. And I believe we've seen that happen. We aren't exploring the full range of possibilities. We know that there are procedures that we can't pursue here in the States that may prove to be very beneficial and less invasive, more holistic, and more effective, that aren't even an option for us because of the protected market we have. A few years ago, there was a woman who wanted to take her teenage son to an alternative cancer clinic, wanted to opt out of the chemotherapy, radiation therapy, whatever it was. And they threatened her with jail because she was going to take her son to Mexico in order to get those things. So I think medicine is full of corporate welfare, where the government intervenes and protects big players in the market and allows them to charge more than they otherwise could, and protects them from competition that would otherwise prove to be more effective. And so I believe the free market would provide some very important cost savings as well as quality improvements in medicine. I believe that the homeopaths, the chiropractors, the naturopaths, the experimental cancer clinics should be able to compete freely here in Idaho. And I kind of resent the fact that regular treatment for cancer isn't identified as experimental, right along with the experimental cancer, treatments, because obviously nobody has the treatments for some of those diseases down, and that's why we call them chronic.
Gentlemen, thank you very much.
And Mr. Bouma, if you'd like to make any closing comments, you have 2 minutes to do so, and Senator Schmidt, if you follow.
Well, as I noted, I believe that there's a lot of corporatism or corporate welfare involved in Obamacare. First of all, I'd like to ask who wrote it. Was it possible that the grassroots maybe wrote it? 2,700 pages of complex legal language that showed up in a hurry in Washington, D.C. I don't think we can blame this one on the Tea Party. It wasn't the legislators. They didn't know what was in it, and they had to pass it to find out. The reality is that big medicine is lobbying hard for it, and Congress themselves exempted themselves from it. I'm not sure how we're going to increase the quality of our medical services by adding layers of bureaucracy and 16,000 IRS agents, for instance. I'm curious as to how many government bureaucrats will have to add in order to fix it when it fails, actually. The other thing about it is, while it is 2,700 pages long, Sebelius has the ability to add to that at will. So I'm kind of curious. Is she a god? Maybe. She seems to have inordinate power in the system. And once again, who makes the most off it? And who wrote it? Those are questions that should be answered. Thank you very much.
Thank you for your time, and thank you for the healthcare question. As a family physician, actually, this is something I'm quite passionate about. And I have to agree, there are lots of things that are in the current healthcare system that are a problem. If you think about it, this is the one take-home thing. This will be on the test tomorrow. Per capita healthcare spending in the United States, we spend 150% per person of what the next country in the world spends, Switzerland. And we are not healthier than Switzerland. We have a wasteful healthcare system. The federal government has proposed something that actually we're going to agree there are problems with. We can do something about it here in Idaho, and that means getting to work on addressing this problem, knowing the problem, understanding the problem, and solving the problem. Our goal here is to provide appropriate, accessible, affordable health care in Idaho. It's my goal. I don't know what yours is. I don't know what your goal would be, but I'm going to listen. And I'm going to listen to my constituents, and I'm going to listen to folks around the state. Now, my opponent has described corporate influence, and he's right. It's out there. And the appropriate legislator listens and balances these pressures to serve the public, the common good. That's our job. That's what I intend to do. Thank you very much for your time today.